he pays on his profits will help us keep the city going. So it's a good ways to start. First, let me thank Roberto Pachulo for hosting us here. The name of the restaurant is 089, and in July 2010, we started giving grades to all 24,000 plus of our city's restaurants, delis, and other eating establishments, including this one. The health department's A's, B's, and C's let customers know about the results of our periodic checkup on sanitary conditions. And today, the health department is releasing the first major study of how the restaurant grading system has worked. And there are 4 major findings, all of them, I think, great news for New Yorkers. First, kitchens across the city are cleaner. More restaurants than ever are making the top grade. Second, and this is the most encouraging sign of all, over the past year, the number of cases of salmonella infection, the best marker of foodborne illnesses, has dropped to a 20-year low. Third, New Yorkers overwhelmingly approve the grading system and use it to make decisions about where to dine out. No wonder New Yorkers support restaurant grades. The proof is in the pudding. And more than ever, the pudding is being prepared according to the highest food safety standards. And fourth, business in the restaurant industry is booming. Restaurant revenues have increased substantially, and it just may be that clean kitchens are as good for business as clean air is that when a restaurant is smoke-free. Let me talk about each of these 4 developments in a little more detail, as well as a new iPhone app. So let me start with the increase in restaurants receiving A grades. At the end of January 2012, more than 72% of the city's restaurants posted A's in their window, and that's up from 65% in January a year ago, 2011, when the program was just 6 months old. And that reflects the fact that restaurants have fewer of the violations most associated with food poisoning and illness. Violations like not having adequate hand-washing facilities for employees or storing food at unsustainable temperatures, or evidence of mice or conditions that might attract pests. Most restaurant owners are clearly paying attention to these food safety practices and taking action. And if you think about it, that's really the whole idea here. The whole idea is to make sure that when you go into a restaurant, you know that it is sanitary, and then you can pick the restaurant based on the quality of the food, whether they cook what you like, and not whether or not any restaurant is unsafe. If every restaurant had an A, it would be just wonderful. The incentives we've built into the grading system are also saving restaurant owners money. In the years leading up to the program, only 19% of restaurants paid no fines. But because we now waive fines for those restaurants who score an A on their initial inspections, 41% of restaurants are avoiding fines. So from the restaurateur's point of view, they're saving a lot of money, and hopefully they're better able to compete for business. At the same time, a number of signs that point to the fact that this program is beginning to achieve its ultimate goal, and that is, as I said, the protecting of health of people who eat in our city restaurants. There's a lot of evidence. The number of reported cases of salmonella poisoning, an important indicator of foodborne illness, as I said, fell 14% during the first year of the letter grading. In Connecticut, New Jersey, and the rest of New York State, salmonella ratings have remained largely unchanged. So it's down 14% here, but in all of the surrounding areas, it has not changed at all. We have a rating system, and they don't. It's pretty hard not to think there is a real connection here. And the result is that the most up-to-date figures tell us that reported salmonella cases in the city are at the lowest level that they've been at any point over the past 20 years. Now, the good news, as I said before, doesn't just stop there. A recent survey conducted by Baruch College found that 91% of New Yorkers approve of posting grades. The survey also revealed that 88% of New Yorkers factor the letter grades into their decisions about where to dine out, and 76% feel more confident in a restaurant's cleanliness if it has an A. These findings really are extremely encouraging, and when we initially launched our restaurant grading program, if you remember, some feared that it would drive customers away. Well, in fact, I'm happy to say that exactly the reverse has happened. Listen to this number. During the first 9 months of the program, which is the most recent period for which we have full figures, total restaurant sales in New York City increased 9.3%, or about $800 million in more businesses. Just in more business. Just think about that. $800 million in 9 months. So if you scale that up, that's $1.2 billion in the course of 12 months of extra business for restaurants. And people said, oh, restaurant grades would scare people away. Quite the contrary. They seem to have given people more confidence in going out and going to a restaurant. Compare that number to the 2 years leading up to the start of the program, where restaurant revenues increased just 2.1 and 2.7%. So whatever it is, people certainly are not being scared away from going to restaurants. Our restaurant industry is now a $12 billion industry, and that's great news, especially in today's economy. Restaurants, as you know, employ hundreds of thousands of New Yorkers. These small businesses are vital to our economy, an essential ingredient in our neighborhoods, and a major reason why people from all over the world come to New York to visit us. And we want these restaurants to succeed. And that's why, since its inception 2 years ago, our new business acceleration team has cut red tape from more than 600 new restaurants, helping them open on average something like 74 days sooner. And in the process, these 600 restaurants have generated more than 6,600 new jobs. I think it's fair to say the bottom line is that this letter grading system, which we devised after 18 months of consultation with restaurant owners, customers, and food safety experts, really has done a great job for the public and the industry alike. It provides restaurant goers with information that's really important to them and that they really appreciate. It provides financial incentives to owners to meet the city's high sanitation standards. It encourages restaurant owners to keep their kitchens in top shape. And it gives restaurants a new and free advertising opportunity. The chance to proudly and predominantly display the A's they earn, just as I noticed when I walked in the door, Roberto does here at Zero Auto Nove, with incidentally the brand new iPhone and iPad app that we're officially launching today, which we can show you, will help you find a restaurant with an A grade, and it couldn't be easier to do. So we have a good system, and we're making it even easier to use. The app, incidentally, is called ABC Eats. You can download it from the App Store. It displays all restaurants and their grades and the results of their recent inspection. It's free, and you can also get it on iTunes. So on that note, let me turn the floor over to our city's health commissioner, who's got a good reason to have a smile on his face, and Dr. Thomas Farley.
First, I'd like to thank the mayor for supporting this program, and then also like to thank Roberto Paciullo at Zero Auto Nove for hosting us here today. 18 months ago, when we announced the restaurant letter grading program, we said we had 3 goals for the program. First, we wanted to provide customers in New York City with information that we had that they wanted about their restaurant inspections in an easy to understand way. Second, we wanted to give restaurants an incentive for engaging in the best food safety practices. And third, our ultimate goal was to reduce foodborne illness. And as the mayor just explained, today we're saying we're making headway in all 3 of those goals. The Baruch College survey, which the mayor discussed, makes it clear that people are using the letter grades and that they like them. Second, our improving restaurant scores and improving grades say that the restaurants are responding. Let me just give you a few details here. Before we did the restaurant letter grading program, 87% of restaurants had an on-site trained supervisor when our inspector was there at the restaurant as required. Now that's up to 93%. Before our restaurant letter grading program, 32% of restaurants had signs of mice. Now that's down to 22%. And third now, and this is particularly important for disease prevention, we have fewer restaurants that are holding food at temperatures that allow bacterial growth. We look forward, as the program improves and stays here over time, to seeing more improvements. Let me say now that nobody would be happier than me in New York City if every restaurant in New York City got an A. Then we have the 14% drop in salmonella rates. It's worth noting that that's almost exactly the same reduction in foodborne illness that was seen in Los Angeles after they instituted their letter grading program. Now, we can't say for sure that the letter grading program is and the improvements caused by it are causing that, but it's certainly very encouraging. Now, when we started the restaurant letter grading program, some claimed that it would really hurt business. But I'll have to say, people said it would hurt business when we instituted the restaurant smoking ban. People said it would hurt business when we instituted the trans fat ban. People said it would hurt business when we put in place calorie labeling. But none of those hurt business. Same goes for restaurant letter grading. The restaurant industry is doing well by keeping us well. So New York City is known for its fine restaurants and its delicious food. With this restaurant grading system, it's fast becoming the city with the cleanest restaurants too. So to everyone in New York City, or everybody visiting New York City, or everybody thinking of visiting New York City, let me say, come here, eat out at our wonderful, safe restaurants. They're the best. Thanks.
Tom, thank you. I should point out that this is a program championed by one of the city's most effective state legislators, Senator Jeff Klein, and he deserves a great deal of credit for making it a reality. State Senator Klein couldn't be here today, but I just wanted to publicly thank him all the same. It was because of his instigation and a lot of his hard work that we focused on and were able to implement the grading system. Also, Robert Paciullo, I want to thank him once again for hosting us. I have eaten many times at Roberto's on Crescent Avenue. Was maybe the first time I ever ate on Arthur Avenue, and I've been a loyal customer ever since. I think the food is just spectacular there, and we wish him all the best. I assume that restaurant also got an A?
Yes.
Thank you. Would you like to say something?
I'm the chef for Roberto Restaurant at 089, and by the health department, I think the last 2 years, they really keeps chef and restaurant owner at the toes, because they come in and they have integrity. And it's not the way it used to be years ago. The inspector, they do really a good job. They just feel little things they should. We spoke already. They just feel little things they should learn a little bit more food, what's right, what's wrong. But they do a great job. We keep restaurant clean. It's like we went back to school. We got A, B, C, and I think it's a great idea. And keep it up with a good job.
Roberto, thank you. Let me just summarize today's announcement for our Spanish-speaking New Yorkers. Un nuevo análisis de nuestro sistema de calificación de restaurantes muestra que hubieron menos casos de enfermedades transmitidas por alimentos y mejores ingresos para la industria de los restaurantes. Muchos restaurantes se han esforzado para cumplir con el código sanitario. Ahora más restaurantes logran una calificación alta y no tienen que pagar multas. We'll take some questions, but before I do, I just wanted to discuss one more issue. As many of you may know, the Health Department has been working for years to make sure parents in every community in the city have the medical facts they need to make decisions on behalf of their children. This really is important because there are a lot of descriptions of problems and proposed solutions that are premised on medical information, sometimes that's certainly not correct, and we want to know that the parents have the right information. There was a case the other day of a baby boy dying from herpes infection, and because of the specific way that the herpes presented itself on his body, the physicians at the medical examiner's office have determined that the herpes was not transmitted by a parent. The evidence demonstrates that it came from oral suction during circumcision. The doctors who found this are objective and independent, and scientists don't answer to anyone other than the truth, including the mayor. At one point, there's probably nobody in public fight. One more point, I think there's nobody in public life who fights harder for the separation of church and state than I do, but I just wanted to remind everybody religious liberty does not simply extend to injuring others or putting children at risk, and we will continue working with the community and others to prevent more baby boys from suffering these tragic fates. With that, we'll be happy to